Okay, good morning, everyone. Thank you so much for joining me today. My name's Tobias Carson. Some people know me by Toby as well. And I'm one of the health and wellness experts who works for 2Health. And my job today is to take you through this new webinar called Breathe Easy, Your Guide to Lung Health. So before I do, I just want to introduce wellness webinars. So every month, 2Health holds a free 30-minute wellness webinar on different health and wellness topics. So for November, our topic is lung health and lung cancer awareness. So if you want any further information on today's webinar, or you have any further questions relating to any of our other webinars, please contact the email that you can see on your screen there. So it's inquiries@2healthlimited.co.uk. Today, we're actually going to start off fairly broad. So we're going to look at the anatomy and function of the lungs. How does it work? How does it work with other systems as well? And then we'll get a little bit more specific. So we're going to look at things like lung disease, how to spot if there's a problem, all the way through to maybe some practical applications and some areas that you can then further research after today's session to help improve your lung function and your lung health. And as November, as I said, is Lung Cancer Awareness Month, we'll finish off with that as a topic as well. So the lungs are part of a complex system called the respiratory system, and its function is to facilitate gaseous exchange, so providing oxygen to the body and expel waste gases. Okay, it's useful to understand the anatomy of the lungs. So we can start broad and think of a big tree. Okay, and if you turn that big tree upside down, you would actually see a similar structure in the lungs. So we start at the trunk, otherwise known as the trachea. Okay, this then divides into two, the bronchi. Okay, sometimes if you just refer to one of them, you'd call it a bronchus. The further we travel down into the lungs, the more divisions of the branches that we see, called bronchioles. And eventually we reach the leaves, okay, of the lungs. These are the little sacs at the end of each of the branches called alveoli. Each alveoli is surrounded by a network of capillaries carrying carbon dioxide rich blood from the muscles ready to be expelled from the body. Okay, through the process of diffusion, vital oxygen will swap with carbon dioxide to be taken to the heart, ready to be distributed around the body in the cardiovascular system, and that's going to be used for energy. Many don't actually realize the complexities of breathing, as this is not the whole picture. As we breathe in, our chest and our bellies expand with the aid of the muscles found in between the ribs. It's also assisted by your diaphragm just underneath the lungs, whose job it is to change the air pressure within the chest, drawing air into the lungs by contracting downwards and then expelling it in a reverse motion and relaxing. Essentially, the lungs, the respiratory system, the cardiovascular system, and the musculoskeletal system all work together to provide oxygen and expel carbon dioxide and other waste products in one of the most important processes we are generally out of control of. And by this, we don't actively think of every breath. It's largely autonomous. The respiratory system is also seen as one of the many systems used in the first line of defense in the immune system. Mucosal layers catching harmful substances and expelling them from the body in a healthy system. So in today's session, we're going to dive a little further into lung health. How can we support this system? How can we identify poor lung health and then take action? And what do we need to be aware of in today's world? What things do we need to avoid? What things can we add into our lives? And I want to start off by sort of identifying the different types of lung diseases that you can come across. So lung disease is any problem in the lungs that prevents those lungs from working properly. Okay, these are three of the main types of lung diseases. So we've got airway diseases, These diseases affect the tubes or the airways that carry oxygen and other gases into and out of the lungs. Okay, think about your trachea, think about as you inhale through the mouth, anything that's on its way down into the lungs. Okay, now they usually cause a narrowing or a blockage of those airways. So airway diseases can include things like asthma or chronic obstructive pulmonary disease, also known as COPD. People with airway diseases often say they feel as if they're trying to breathe out through a straw. The second one that we'll look at are lung tissue diseases. Okay, so these diseases affect the structure of the lung tissue. So scarring or inflammation of that tissue makes the lungs unable to expand fully. So you can also refer to these as maybe restrictive lung diseases. This makes it hard again for the lungs to take in that oxygen that's come through the airways and then release the carbon dioxide through diffusion. People with this type of lung disorder often say they feel as if they're wearing a too tight a sweater or a vest or maybe a straitjacket. And as a result, they can't breathe deeply. And then the last one on this page are lung circulation diseases. So these diseases affect the blood vessels in the lungs, so those capillaries that surround the alveoli. Okay, they're caused by clotting or scarring or even inflammation of those blood vessels. They affect the ability of the lungs, similar to what you'd say with the tissue diseases. It affects that diffusion process. So it affects the ability of the lungs to take up oxygen and release carbon dioxide again. Okay, these diseases could also affect heart function. So an example of lung circulation disease is something like pulmonary hypertension. And people with these conditions often feel short of breath when they exert themselves. What a lot of people don't realise about lung disease is that many lung diseases actually involve a combination of the three types here. And the most common lung diseases include things like asthma, collapse of part or maybe all of the lungs, so this could be referred to as something like a pneumothorax, swelling and inflammation in the main passages or those bronchial tubes that carry that air to the lungs. Things like COPD is something a lot of people have heard about. We've got lung cancer, which we'll go into towards the end of today's session. Lung infections like pneumonia. And then we've got abnormal buildup of fluid in the lungs, also known as something called pulmonary edema. And then we've got blocked lung arteries as well. These are the most common lung diseases. And what's really important to understand about lung diseases is that we ourselves can't diagnose them. We need to seek diagnosis from doctors and medical professionals, but we can keep an eye out for our symptoms. So the diseases that were mentioned on the previous slide will all have a complex range of symptoms. And we need to be aware of those symptoms so we can take care of our lung health in the long run. Okay, so that's the first sort of key to lung health, looking out for your symptoms and knowing when it's a big problem. As we know, early diagnosis when you're ill is crucial for the best treatments and the best management of your symptoms. So those symptoms may indicate a problem with your lungs. So things like a chronic cough. A cough that you've had for maybe 8 weeks or longer is considered chronic in adults. If we're referring to children, it's referred to as chronic if it's for 4 weeks. This is an early symptom that tells you something's wrong in the respiratory system, and it could be a whole multitude of things. Shortness of breath. So it's not normal to experience shortness of breath that doesn't go away after, say, exercising, or that you have after little or no exertion. Laboured or difficult breathing, the feeling that it's hard to breathe in and out is also a warning sign. You've got things like chronic mucus production as well. So mucus, which can also be referred to as sputum or phlegm, it's produced by the airways as a defense. It's one of your immune responses against things like infections and irritants. But if your mucus production has lasted a month or longer and it's in excess, this could indicate some form of lung disease. That sound of wheezing, so noisy breathing or wheezing, is a sign of that something's unusual, and it could be something that's blocking your lungs' airways or making them too narrow. A very big warning sign for a lot of people would be coughing up blood. So if you're coughing up any blood, it may be coming from your lungs or the upper respiratory tract, and wherever it's coming from, it can signal a health problem and it needs to be seen immediately. And then things like chronic chest pain as well. So unexplained chest pain that lasts for maybe a month or more, especially if it gets worse when you breathe in or maybe if you cough. So you got to make sure you're looking out for the types of chest pain as well. These symptoms can be the result of, say, an injury, but it can be disease of the lungs. Okay, it could be a part of a problem in the whole respiratory system. So if these symptoms persist, it's important that you see a doctor, maybe even a lung specialist, to determine what's causing them and prevent further damage and provide some relief for yourself as well. And the first step to reducing your risk of things like lung disease is understanding what the risk factors are that increase your risk of developing one. So knowing your risk factors, that first step in preventing or even lowering your risk. Okay, anybody can get a lung disease, but there's some lifestyle choices and even environmental factors that can greatly increase your chances. Some risk factors are actually genetically determined, and therefore there's not much we can do about that. So the main risk factors for lung disease are things like your age. So the older you are, the more likely you are to get lung disease. And this actually relates to a lot of different diseases as well. Okay, we become a lot more susceptible as we age. Again, bringing up genetics. So a family history of lung disease makes you more likely to be prone to a lung disease. Smoking or even secondhand smoke. So the more cigarettes that you smoke each day and the longer that habit continues, the greater the risk of lung disease like cancer or even COPD. We've got things like environmental causes as well. So exposure to things like radon gas, asbestos, arsenic, and other harmful substances can increase your risk of developing lung diseases. Allergens can also trigger problems with the respiratory system. You can actually search radon and other harmful substances on government websites, and this will help you to find certain areas to avoid, say maybe when you go out to exercise or go for a walk. So you can use those websites to find those areas. Maybe you want to avoid moving to that particular zone, and you can find further guidance on how to reduce your risk if you do live near one of those areas. And the last risk factor are if you've already got another chronic disease. So people with maybe a heart disease, maybe you've already got some version of a chronic respiratory disease, people with diabetes and other diseases are at an increased risk of developing a lung disease. Okay, and you can develop other diseases as well. It's because your immune system becomes suppressed and it's working overtime, so it's easier to pick up other diseases. So understanding the risk factors is the first step. Okay, so step one to improving your lung health and your lung function is to reduce the risk factors the best you can. Okay, this will help you in the long term. And there are more steps that we can actively take, especially as we age. We've got 3 steps that I'm going to go through here. Okay, these are 3 of the most powerful steps that you can take. So stopping or not smoking, doing regular exercise and looking after your posture, and even eating a good and balanced diet, which are good, pieces of advice for general health, not just lung health. There's a lot more that we could actually add to this list as well. So we're just seeing a nice overview of the most powerful ones that you can take. So please feel free to continue your research into this topic after our introduction today. The first one we're going to look at is that's not smoking or stopping smoking. So cigarette smoking is the major cause of lung cancer and chronic obstructive pulmonary disease. Smoking actually causes around 7 out of every 10 cases of lung cancer, so 70%. And that stat comes directly from the NHS. What we do know about cigarette smoke is that it can narrow the air passages and make breathing more difficult. So it does cause chronic inflammation and swelling in the lungs as well, and that can lead to things like chronic bronchitis, And over time, cigarette smoke actually destroys lung tissue and may trigger changes in that tissue that can grow into certain cancers. Quitting is the only effective way to reverse those effects and regain lung function and health. So we know that by stopping smoking, after 72 hours, breathing can feel easier. And it's because your bronchial tubes have started to relax, and energy will actually increase due to that increased oxygen flow and the availability of oxygen around the body. After 3 to 9 months, any coughs, wheezing, or breathing problems will improve as lung function can actually increase by up to about 10%. And then after 10 years, your risk of death from lung cancer will have halved compared with somebody who would continue smoking. So one method that could be used alongside tools such as like nicotine patches, inhalers, and gum could be a tough subject to discuss, but vaping. Now, there are many differing opinions when it comes to vaping, and we're providing this information as a safer alternative to combustible cigarettes and to help you quit the more harmful substance that you get from the cigarettes. So the actual overall aim here, when we're sort of introducing vaping, is that you'd have put a full aim in of quitting altogether, both smoking and vaping, but you can use this almost like a stopgap. So electronic cigarettes or e-cigarettes are relatively new devices, and they develop nicotine vapor to the user via a mouthpiece. Okay. E-cigarettes, they deliver that inhalable aerosol vapor by heating a solution that typically contains nicotine, glycol, maybe even glycerol, and then it's got flavorings. So there's no combustion involved in e-cigarettes. And so the vapor doesn't actually contain things like carbon monoxide and other dangerous chemicals that are associated with tobacco combustion. There was an evidence review that was commissioned by Public Health England, and they examined the safety and efficacy of e-cigarettes. And the review concluded that e-cigarettes are significantly less harmful than smoking tobacco, and that can actually help you assist with quitting smoking. The report recommends that all smokers should be supported to stop smoking completely, including dual users who smoke and use e-cigarettes. So we're going to look now at the other things that we can do to look after our lung health and improve our lung health. These are things that you can do actively. Okay, so we start off with exercise. Now, when you're physically active, your heart and lungs work harder to supply additional oxygen to your muscles on demand. Okay, just like regular exercise makes your muscles stronger, it also makes your lungs and heart stronger and more efficient. As your physical fitness improves, your body becomes more efficient at getting oxygen into the bloodstream and transporting it to those working muscles. And that's one of the reasons that you're less likely to become short of breath during exercise over time. There are some types of exercise that can also strengthen the muscles of the neck, the chest, including the diaphragm and all the muscles, the intercostals between the ribs, that work together to power that inhalation and exhalation. So finding a balance in your exercise between aerobic or cardio and weight-bearing exercise like dumbbells, yoga, Pilates, okay, maybe even body weight training, that will actually net the best overall effect on your lung function, meaning that at rest, your body doesn't have to work as hard to complete its everyday tasks. And alongside doing things like weight training and stretching, when it's done correctly, weight-bearing exercise, stretching, yoga, and Pilates can all contribute to a better overall posture. So less rounded shoulders, less lower back compression. When we have rounded shoulders and lower back compression, our rib cages get stuck in an exhaled position, and that's going to reduce the effectiveness of your inhalation and your overall ability to get more air into the lungs. So by practicing good posture, by putting the string on the middle of your head and pulling up, okay, and completing strengthening exercises, and even practicing something called postural breathing, that's a good one to Google, well, that will help you to bulletproof your ability to correctly access your lung function. You can even practice certain floor exercises while holding a neutral spine. Okay, so not trying to force your lower back into the floor, but finding the top parts of your hip and your upper back resting nicely on the floor, and taking long, slow, and full inhales and exhales will help your body to relax better into better postural positions. That way, when you stand, our body will naturally hold better positions, and that will create more space for the lungs to expand. And then the last way that we can help is that classic of a balanced and good diet. So fruit and vegetables have vitamins and minerals that support your immune system to help fight off things like chest infections. Carbohydrates give your body energy for breathing and everyday tasks. So choosing things like high fiber or whole grain versions, such as like the brown pasta, the brown rice, the wholemeal bread, they'll help you to feel fuller for longer, giving you that added benefit of not wanting to snack as often. But they'll also give you energy for longer because they take longer to break down. They also protect your heart and help digestion. So you're getting a lot of extra benefits by choosing a balanced diet and not only helping your lung function. Protein helps to keep your muscles strong. So this includes your chest muscles and your intercostals, which help your ribs expand as you breathe. And that's going to help you get the most out of the exercise that you're putting in as well, and more efficient with every breath. Protein is also important for your immune system as well. And then we've got things like dairy and oil. So these are also high in vitamins and minerals, things like vitamin A and E. And again, these are very important for fighting those infections. So a healthy, balanced diet is key, okay, not only to your lung health, but to overall health. So using something maybe like the Eat Well guide and putting on a rule of maybe everything in moderation can come very handy when it comes to bulletproofing your overall health and your lung health. And as it is Lung Cancer Awareness Month, we'll finish our session with some awareness. Now, I apologise if this is a hard subject for anybody watching today, but lung cancer is one of the most common and serious types of cancer. Okay? And more than 43,000 people are diagnosed with the condition every year in the UK. Cancer that begins in the lungs is called primary lung cancer. And cancer that spreads to the lungs from another place in the body is known as secondary lung cancer. Now, this slide is about primary lung cancer. And there are two main forms of primary lung cancer. These are classified by the type of cells in which the cancer starts growing. So they are the non-small cell lung cancer, which is the most common form. It accounts for around 80 to 85 out of 100 cases. And then you've got small cell lung cancer, which is less common, but it usually spreads faster than non-small cell lung cancer. Lung cancer mainly affects older people. It is rare in people younger than 40. More than 4 out of 10 people diagnosed with lung cancer in the UK are 75 or older. And treatment depends on the type of mutation the cancer has and how far it's spread and how good your general health is as well. So if the condition is diagnosed early and small in area, then surgery to remove that affected area may be recommended. If surgery is unsuitable due to your general health, then radiotherapy to destroy the cancerous cells may be recommended instead. If the cancer has spread too far for the surgery or radiotherapy to be effective, then chemotherapy is usually used. And there's also a number of medicines known as targeted therapies. Now, targeted therapies cannot cure lung cancer, but they can help to slow its spread. Lung cancer doesn't usually cause noticeable symptoms until it's spread through the lungs or even into other parts of the body. And for this reason, it means that the outlook for this condition is not as good as any other types of cancer. So about 2 in 5 people with the condition live for at least 1 year. And then about 1 in 10 people live at least 10 years. The symptoms of lung cancer are similar to the symptoms we mentioned earlier. They can include things like a cough for 3 weeks or more, a change in the cough that you might have had for a long time. You might get repeated chest infections, or maybe a chest infection that doesn't get better, feeling breathless or wheezy, coughing up blood. Okay, you might have a hoarse voice alongside a cough. There's other possible symptoms here as well, like things like a loss of appetite, losing weight for no obvious reason, and maybe even feeling tired. So if you do have any of these symptoms, it's important to get them checked by your GP. And many of these symptoms can be caused by other lung conditions as well, and even by smoking. 7 in 10 cases are caused by smoking. Okay? Breathing in radon gas is another possible but lower level cause. And there are also some occupations out there that use harmful chemicals and pollutants as well. If you want more information on this topic, please use charities such as Cancer Research, even Macmillan. They have much more information on diagnosis, treatments, and how to live with lung cancer, should you need any further info. The NHS website is also a fantastic resource to use as well. So I hope you've enjoyed today's session, a nice brief overview into lung health and how we can make things better. Okay, and thank you so much for following me through that webinar as well. I hope you enjoyed that content. We really appreciate any feedback that you guys can offer us. So if you could grab your phone, open up the camera app and follow the link that you can see on the screen here, or use that QR code and go to our feedback page and let us know how I did today. And if you have any further inquiries or want to book your own webinars for your company, please contact us using the details that you can find above. Okay, and find a bit more of our content on things like YouTube and follow us on social media for more updates and future webinar events. So thank you all again, okay, and I hopefully see you next time for the next subject. Cheers.